Hi, Dr. Pelto here. I have this question. What do you do for arthritis in the middle of the foot? Let me share an example of a patient that came in. You can see these little red lines here. I'm going to talk specifically about midfoot arthritis. That means arthritis in the middle of the foot. This can be quite debilitating. If you look at the x-ray on the right foot here, there are all these things that look like little mountains on the top. Do you see that? That's midfoot arthritis. If you look here on this other side, it looks more even. It doesn't look like so mountainous. And this patient has midfoot arthritis on the right foot, but not on the left foot. What does that typically feel like? Well, patients with midfoot arthritis, they have pain and they typically have swelling on the top of the foot. And it's difficult when they're doing standing and walking for longer periods of time because the bones, they jam and they cause more and more pain. So it's an arthritis type of a pain. How do you treat it? Well, I have this arthritis treatment evaluator, and I want to focus on one aspect today, which is an ankle foot orthotic, which is something that you may not have heard of. But just to start, there are some treatment options. My main go-to is going to be a cortisone injection in that joint. Patients, before they see me, they tend to try these things under the yellow line, which would be anti-inflammatories, icing, topical creams, compression sleeves, arch supports. These things people try before they see me. I usually start with a cortisone injection. I don't find shockwave all that effective. I've had one patient that did okay with it. It doesn't really heal the arthritis, but it makes it feel a little bit better in the middle of the foot, the shockwave treatment. Amnio injection is also another option. This patient has orthotics. And the reason I do orthotics is to reduce the movement in those joints. The less those joints move, the better they feel. They have appropriate shoes, they have home sandals, and we're trying to avoid this, which is a midfoot fusion. Specifically, I want to talk about the idea of an ankle foot orthotic. Why? Well, because a walking boot, it's hard to use long-term, and the ankle foot orthotic is a good option. So let's look at that. Actually, we'll talk about orthotics first. What these do is they reduce the abnormal movement in the middle of the foot. That's how they work. The patient's already using that. This is an example of an AFO. There's a couple of different types. These are made by Arizona, and this one's made by Ritchie. And basically, this one is a lace-up brace that doesn't allow any movement at the ankle joint. And so if you have a good ankle joint, you tend not to want to use this one. This one just goes in the middle of the foot. It looks kind of small, but it's a little bit bulky, and it goes right around the middle of the foot where it hurts to reduce the movement. And then the last option, which is kind of the newer one that I'm kind of recommending for patients, it has an orthotic built in, and it has this little carbon fiber thing that goes up into the front of the leg. And what that does, it puts all the pressure into the front of the leg for the patient. So it's a good option to offload the area. By putting pressure into the lower leg, it takes pressure off the middle of the foot and also the orthotic. This combination is something you might want to ask your doctor about. I'll put some more information underneath this video about the name of that brace if you'd like to know. And certainly if you have any other questions or thoughts, just ask me. It's about, if you want to buy it, I think it's about $800, maybe a little bit more. Because of the orthotic. If you do the orthotic embed in it, it's adding an orthotic onto it, which is about $500 to it. So it's expensive, but imagine if people are having pain all the time, it's maybe a non-surgical option for you. I'll put some other links to other videos you might find enjoyable. Please like this video and subscribe to this channel if you haven't. I'd love to make more videos. If you have other video questions, put them underneath. Okay, thanks.